acne can be a major problem really for people of all ages, but teenagers are often the most sensitive about it. Some school activities could even aggravate skin problems. Board-certified dermatologist Dr. Sherry Ingraham is here with some information on how to keep your skin clear, even when you're working out in that Houston heat. And thank you for coming in, because the adults deal with it and the kids deal with it, but when school starts, the sports start back up again. So that can be a problem, right?
Yes, we usually see an influx of patients right before school starts. Everyone wants to get ready for school, and then after school starts, when those activities, band, football, baseball start, and the sweating and the heat really takes its toll on the skin.
So what do you recommend?
So typically what I'll recommend for younger patients is get a salicylic acid or benzoyl peroxide based over-the-counter wash. Wash your face after every sweaty activity. Don't go home, have dinner, then wash your face. Wash right after you play the game. Also, they have wipes now, little wipes that are single use, and you can get either a prescription from your dermatologist or over-the-counter a sal acid or BP-based wash or wipe. And then keep them in your bag at school, keep them in your sports bag. Right after you come in off the field, wipe. Before that, bacteria and oil commingle and set up shop.
What about acne that has led to scarring?
Yeah, you know, I always tell patients my job is to prevent scarring. Their job is to keep their skin clean, but my job is to prevent scarring. And so scarring is due to inflammation in the skin. And typically when you see a lot of inflammatory lesions that aren't healing well, and even some that are healing and there's any redness, it's going to lead to scarring. And so we need to intervene with a stronger medicine, some type of oral medicine like an antibiotic, even Accutane. Once there is scarring, you don't want to wait. You want to continue those medicines, but also consider things that can prevent and treat scarring, like laser. We have new laser technologies like Fraxel that's come out in the last few years that does an amazing job on acne scarring. You know, and people need to know acne scarring does not have to be permanent. It is a treatable condition in most cases.
And it's a little bit different from teenagers to adults. What if you have an adult who's had scarring for some time? Can those treatments still work?
Absolutely. You know, you want to get in there early. The earlier the better when the inflammation is still there. But certainly we have lots of adults who come in, and I tell them they're so lucky because in this day and age, we can actually remove a lot of those deep ice pick scars, some of those rolling scars, with a treatment like the Fraxel laser at a dermatologist's office.
Now, you talked about your job being prevention. What do you recommend to people in general that maybe they don't think about on a day-to-day basis?
Diet is huge. You know, and I've said that so many times before, diet is a huge part of the problem. We all, studies have shown, have bacteria on our skin. We all have the P. acnes bacteria. Some people react to it more than others, and diet is a huge part of that. So things that are pro-inflammatory, milk, all dairy products, sugary foods, not just chocolate, foods with sugar, all stimulate acne sebum production and stimulate bumps. And so you want to get off those things. Also, wash your face twice a day. Studies have shown more than that doesn't necessarily help. And then sunscreen, because the minute you start to have those acne lesions, they can leave dark marks or they can leave red marks and even scars. And sunscreen helps to prevent that collagen from having, as I tell patients, that scar being embedded in the skin. So wear your sunscreen. Even if you're acne prone, there are facial sunscreens that help prevent acne and also help prevent scarring.
Good advice, doctor. Thank you so much for coming in this morning. And you should consult a dermatologist if your acne has made you shy or embarrassed, the products that you've tried haven't worked, or like we've been talking about, if your acne leaves scars or your skin has darkened.